where we are going to be focusing on some resources. So the Healthy Caribbean Coalition and some of our partners have developed a few youth-focused tools that we wanted to share with you. And so I'm going to do one to show off one resource. And then we have a video that has been created by Carrie Barker that we're going to share of another resource. And then at the end, I'm going to invite my favorite peer to speak about a resource that he has been working on for some time now. Okay, so everyone, I'm going to need your engagement here. All right, I'm just going to share my screen. All right, and this is my sales pitch, okay? So, by raise of hands, do you want to better understand how to develop an advocacy plan? Can I see those hands? Yes, peer, tell me. Yes, 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 I'm seeing the hands, great. I hope that you would say that. We have a guide for you. Do you want to know more about funding for your advocacy projects? Can I see your hands raised? Can I see some thumbs up? Yes, we do. And I got your answer for you. We got a resource for that. And do you want to know how to better understand how to shape your advocacy messaging? I saw some hands. Yes, yes, yes. You might have guessed it. We have a resource for you for that. And whoops. Lastly, do you want to understand how to better deliver your advocacy messaging? So we've been talking about what the messaging, oh yes, I'm seeing hands before I'm even finished. Great. We've been talking about what the advocacy message can be, but the delivery is so important. And I'm seeing hands. That's great. You might have guessed it. We have the tool for you. So the Youth Voices and Health Advocacy Spaces Toolkit has all the information I mentioned and so much more. So this resource was designed, let me flip here. Right, here we go. So this resource was designed by youth from HCY and the World Obesity Federation, and really is your one-stop shop for advocacy, especially if you're interested in this space, the health advocacy space. But as Christina mentioned, it has little information nuggets for anyone who's interested in advocacy. So Youth Voices and Health Advocacy Spaces, which inspired this very 2-day workshop, was created by youth who wanted to provide the information they wish they knew they had at the start of their advocacy journey to youth and their allies. So it creates all the background information we learned about on day one, including the issue of childhood obesity and using a rights-based advocacy framework. And so in its entirety, the tool aims to offer guidance in creating an advocacy plan, like I mentioned, whether that's in health advocacy or otherwise. And ultimately, it is our hope that the practical strategies and guidance offered in the toolkit can support your efforts around cultivating healthier environments for children and young people. I saw those hands up. So I'm going to invite everyone to scan that QR code, get your copy of this resource that was developed by Healthy Caribbean Youth and youth from the World Obesity Federation, including Pierre, who we're going to talk to later. So that is resource number 1. How are we doing? Are we good? Yes, yes. Okay, great. Hopefully I sold you on that. Yes. Right. And then Janae, I'm going to invite you to show another resource. Yes, Shaniel, love that. Good, great. That Carrie Barker, who's our project assistant, she would have put together this video. And so really, I'm going to let her describe it. But it's another resource that you need to add to your prep pack.
In this video, I will be giving an overview of the Healthy Caribbean Coalition's Childhood Obesity Prevention Scorecard, a simple, interactive web tool that allows advocates to track Caribbean countries' progress on key policy and programming areas related to childhood obesity prevention. For a bit of background, in 2017, the HCC launched its Civil Society Action Plan to guide civil society's contribution to and support for national, regional, and global efforts to support childhood obesity. The plan has 7 priority areas, which are based on national, regional, and international guidelines for responding to childhood obesity. The scorecard serves as a monitoring and evaluation tool for the action plan, as it tracks country progress across 16 indicators related to the 7 priority areas outlined in the plan. To access the scorecard, first go to Home on the HCC website and select Childhood Obesity Prevention. This will direct you to the Childhood Obesity Prevention portal, where you can access the scorecard either from the menu bar or by scrolling down on the page. Once you reach the scorecard, select your country of interest and have a look at their progress across the indicators. Policy implementation is measured using a traffic light approach, where green signifies that the policy or action is present or implemented, yellow signifies that it is under development or partially implemented, and red signifies that it is absent or has not been implemented. For policies marked in green or yellow, we link to a source or supporting document, which is ideally the official policy or legislative document, but in some cases are official reports or articles from the media. Clicking Read More will open the file in another tab or window on your computer. Finally, if you want to compare progress across the region, you can select to view a regional snapshot, which is available for online viewing and as a printable PDF. So there you have it. The scorecard is an easy to access, easy to use tool that tracks progress across relevant childhood obesity prevention policies and programs in the region. I hope it becomes a valuable tool for advocates in researching policy landscapes and holding their governments accountable.
Sweet. Thank you, Carrie. So I'm hoping everybody, I know we all have country pride. We all have country pride. So if you want to know how your country is doing with all the policies that we've been talking about, please, please, please check out that COPS. And we're going to have a slide with the resources again, so you have access to them. But it's a great resource that, again, you can see how your government is doing in your country to really implement these childhood obesity prevention strategies we're talking about. Okay, now it is my pleasure to welcome Pierre Cook Jr., who's our youth advisor, technical advisor. And Pierre, we have been working on this agenda for some time. So I'm so excited that you're able to share kind of what has been happening behind the scenes. So I'm not even going to say the name of the resource. Pierre, I'm turning it over to you.
Thank you, Danielle. And I'm really happy to be here with you all today. And I think I just wanted to say before I jump into it, testament to why we formulated and created Healthy Caribbean Youth. One of the pillars was capacity building. And so we wanted to make sure that those persons who were a part of the organizations were given the tools so that they can go out there and confidently, be good advocates. So there you have a snapshot of what policies are happening within your countries. And you can see when you go to your policymakers, you can say, well, I know that Barbados has this, but we don't have this, and we want this. Even beyond that, you have tips and tools of how to communicate with the press, how to post and put out information about your advocacy. And then I'm going to take you to the final one, my baby, my precious project, and that is our rights-based childhood obesity prevention agenda. Now, for those of you who know me, or those of you who will get to know me, you'll know that I'm a law student, an aspiring attorney, and I'm also an advocate for human rights. One of the things I've recognized over the year is that a key element that was missing from childhood obesity prevention advocacy was that rights agenda. So basically what it is, and we discussed it last week, everyone is entitled to human rights. Everyone has access to human rights. Governments have a responsibility to ensure that they protect the human rights of persons. And so what this agenda has done is taken those rights of a child and formulated it in a way to say, well, hey, childhood obesity is an issue. We have a right to the highest attainable standard of health. And what we did is break down into smaller bits and pieces how those rights are formulated, and then how you can use it to push your advocacy. So basically what it's saying is, you may have been going to your Minister of Health, you may have been going to your Prime Minister, you may have been going to your policymaker and saying, it would be nice if we have a school nutrition policy. You know, it would be nice if children have access to medication. We really would like you to do such and such. What this provides you is a stronger basis for your advocacy. So instead of saying, we're asking you to do it as a moral thing to do, we're telling you that it's your legal responsibility. And so that makes your advocacy so much more stronger. Now, the way this toolkit has been formulated and prepared, it's for any youth advocate at any stage. If you don't have any idea what a human rights is, where you can find them, we've made sure to include where you can find these human rights, what they are, and broken them down into tangible language. So it's not highfalutin legal language, and I'll have you know that it was vetted time and time again by youth advocates, young persons who attested to the fact that the language was something that they could understand even at their level. So we had persons as young as 14 who reviewed the agenda. What HCC wants for you to do is to take this agenda, look at the principles of human rights and rights-based advocacy, and incorporate it into your childhood obesity prevention agenda. Now, this is just one area. It's looking at childhood obesity prevention, but through this document, you will again be able to see how you can leverage children's rights for your advocacy projects. So Christina mentioned earlier, education is one of her passion areas. You can see through this document how you can look at all the sources of children's rights to advocate for a right to education. And that's all we want you to understand. You have a legal right, and your governments have a legal responsibility to ensure that you have the highest attainable standard of health. And what we've done is given you a succinct document to tell you how you can go about advocating for these rights for children in your community. So I'm really happy for us to have put this together. We'll be able to share it with you soon, so you can have access to it to continue your advocacy. Yeah.
Thank you, Pierre. So I think, and I don't think I need to see anything further. I think from the 3 resources, you got an idea of one, as Pierre said, we're really aiming to ensure that as advocates, you feel comfortable in the advocacy space, in the spaces that you occupy, especially if you are encountering policymakers, or if you're, going to your school principal about a healthier food environment in schools. So we're giving you the tools. We will share them in the chat. And as Pierre said, we're really, really excited to share his agenda, which should be ready soon. So thank you so much, Pierre. Thank you to Carrie. And I know we're running a bit tight on time. So Christina, I'm going to turn it over to you and invite anyone who has questions for Pierre. I know Carrie's on, or myself, about the resources, type in the chat and we'll get right back to you.
All right. Thank you so much, Daniel and Pierre. I was trying to figure out which one of the resources was my favorite, but at the end of it, they're all so good. And I'm looking forward to engaging with them all. I'm very excited about Pierre's right-based toolkit. I think that's a very important addition to the tools that we need in our fight, because as you rightfully said, Pierre, that a lot of times we go to these different stakeholders and the approach is we would like, we're trying to base it on their conscience, but through this particular toolkit, we may very well be able to say, this is our right, we demand it, you must implement it. And I think it gives us a stronger tone, a stronger foot to stand on, if that's the term. And I think it will really help the advocacy across the region. So thank you for that. And just to reiterate as well, you'll be able to access these resources in your prep pack, as well as on the HCC website. I am not sure exactly the timeline for Pierre's toolkit, but for the other two, the scorecard and the advocacy toolkit, you will be able to access it now on your prep on the HCC website and in your prep pack.